Let's bring him in. Our good friend, Dr. Joe Congenital, Sports Medicine Center at Akron Children's Hospital. Good morning, Dr. Joe. What do you have for us this morning?
Hey, Ray. How you doing today?
I'm doing terrific.
More like it weather-wise, man. I'll tell you. Pretty nice week, huh? All the spring sport kids are really enjoying this.
Doesn't get much better, my friend. That's for sure.
So Ray, this is a little bit of a complicated issue, but you guys, your audience is so good. But we've had a few of these this year, and one came up recently in the draft as well. And I just wanted to mention what happened in the draft, and it's well chronicled and discussed. There's a wonderful wide receiver by the name of Justin Ross from Clemson. He really burst on the scene a couple of years ago, catching passes from Trevor Lawrence and things, and he was supposed to be so talented, a surefire number one pick. And in the most recent draft where he came out a couple of weeks ago, he didn't get drafted at all. And one of the big problems is a couple of years ago, he got hit, he got injured. They took just a routine X-ray, neck X-ray, and they found that he had a thing called a congenital malformation. In the old days, we called them congenital malformation, big name thing. What it means is a born with, and now we call it a congenital variation. We've gotten rid of that. Kind of sounds like a scary name, malformation. Congenital variation. And these variations around the neck and spinal cord can put people at risk for permanent paralysis and things. And so we have to think about them long and hard before we allow people to play. I see this young man did sign outside the draft, but he has a lot of doctors weighing in on whether he should play or not. And we've had three of these this year that I've been involved with down at the Sports Medicine Center. So I just wanted to mention, most of the time, Ray, when these happen, they're picked up incidentally. You know, a kid gets hurt for something else, they get an X-ray, or even sometimes continuing pain, and we get an MRI, and we notice that the way they're made, they have a variation of normal, and then we wonder, could it be something that would put them at risk? So some of those variations, like in this kid Justin Ross from Clemson, he had two bones of the 7 bones in the neck, 7 cervical vertebrae that were fused together, and they were at a spot that could really make the neck really stiff. And if he took a hit, could it put enough stress on the spinal cord to put him at risk for paralysis? So that was the big thing they were worried about at Clemson. Sometimes there's areas in the spine where the neck didn't fuse at all, and it was supposed to fuse, and we wonder if it's a weak spot. You know, it's held together by fibrous tissue, not a bone. And so that happens sometimes when we study these further. Or we study them with an MRI and we see the spinal cord is narrowed or the spinal cord didn't close all the way, and we wonder about them. So traditionally in sports medicine through my career of 30-plus years, there's a place at the University of Pennsylvania called the Head and Neck Registry. And because these aren't that common, everybody sends the results and how the people do to the Head and Neck Registry, so we at least have some numbers to look at of how these kids do. But typically and nowadays, we have to get certainly a couple of opinions on these cases, and usually it's our neurosurgical team that really gets very involved and helps with the decision making of, is this a risk? Should a kid go on or not? And the real confusion, the head scratcher for a parent is, you know, we tell them they were born this way. They've had this for their entire career. And the parent says, gosh, they played lacrosse or a contact sport, football. They played a collision sport. They played for 5 years, 10 years, 12 years, and never an issue. And then in one particular time, they'll just get hurt in what looks like a routine injury. And we find that there's something about the way the spinal cord's made that might put them at some risk. So it's a head scratcher. It's frustrating. It's called variations of normal. And in the neck, we have to look really closely at these things. And this, we feel for this great young receiver who's very talented, but right now a lot of people saying, boy, just too much risk for him to play football in the NFL. And the same kind of thing happens in some of our kids in junior high and high school right here in Akron, Ohio. So we do battle these congenital variations, and I wanted to get a chance to kind of try to explain this a little bit this morning.
All right.
Thanks, Ray.
Yeah, most certainly, Joe. Good information. And sometimes we hear about these and we're going down the road and say, oh, I didn't know that. Well, as you can hear Joe saying, not too many people knew about it until something else happens. Joe, great stuff this morning, my friend. Good talking with you again. We'll catch back up with you next week.
All right, Ray. Have a great week. Enjoy this nice weather.
You
Thanks.
too, my friend. Dr. Joe Congenital, Sports Medicine Center, Akron Children's Hospital with us.